Thank you, Jose. Thank you for allowing me to talk about my region. As you've seen, Spain is very complex, and this is not mine. No, it says Toni Dideu. Yeah, this is mine. And what I'll try to do is to give a completely different perspective of what we've been listening today, because currently I'm working for the Ministry of Health of Catalonia, and that gives a completely different perspective from what you've been given here these days. But at the same time, I'm a GP and I'm a family medicine doctor, and I have the two hats, so I feel quite ambivalent of what I can say and what I feel sometimes. But I'm going to give the formal presentation. And one of the things we've been talking about when we develop indicators and is behind the indicators we get in the 21st century, there is a tool to obtain indicators, and this is about how we manage ICT technologies. This is the ABC. It's like Gutenberg with the printer, so now we've got ICT tools to develop. And this is a different view from what we see, how we see Europe from Catalonia, because Catalonia is a region in the south of Europe, but is a region in the north of Spain. And what happens in the health services, and most of you, I think, will agree, is that the delivery of health services happens at a regional level or municipal level. So when you try to explain from a national point of view what happens in general, I think we create a big bias, and we are not talking about reality. In fact, Catalonia is working with lots of other European regions, and we feel the same. Catalonia was the first autonomous community in having the devolution of the health services. So we are talking about more than 30 years. So it's quite a long period to be able to evaluate what we've done. And this is the ownership of the healthcare facilities in Catalonia, and this tells a lot what I'm going to explain later. So in hospital care, most of the hospitals, the ownership are from different ownership formulas. Some are private, some are consortiums, some belong to some religious orders, sometimes belong to insurance funds. And in primary care, more than 75% of the centers belong to the state, but this is in a process of transition as well. So in the next 3 years, the 70% of the primary care centers, it will turn into less than 10% will belong to the state. So we are in a new stage of changing Catalonia. But this is one of the most important things from our point of view, and as I'm sorry for the slide because there are some other writing behind that. That is the primary care. Primary care in Spain is, and this is general for all Spain, we've been working on more, almost 30 years in multidisciplinary teams. When I mean multidisciplinary teams, is when the patient is in the center, and in the same center, some GPs work there with pediatricians, nurses, nurse liaison, social workers, and then around the second circle is all the other professionals that work around primary care. Maybe they don't work physically in the same center, but they work closely and close related, and they are considered primary care professionals. So this is very important in terms of how primary care is organized. And going into the strategy of ICT in Catalonia, we've got currently a problem with the growth of immigration. Aging is a problem in Catalonia. The new model of relationship patient-doctor, we are facing that the patients they are more informed, and the way of communication between doctor and patient is changing. New styles of life, new diseases for the Catalan population. We are adopting lots of northern habits, drinking more beer, eating more more meat than we used to do it. So sometimes the north doesn't bring us so wealth. Shortages of medical professionals. Doctors are going abroad because they are better paid. And new medical technologies, how to use those new technology. But we face another situation. We are in an economic crisis. Despite Catalonia is one of the 10th wealthiest regions in Europe, but we are struggling in the economic recession as well, and we need to maintain economic competitiveness. So what happens with that? There is a pressure to increase spending, and there is a pressure for cost containment, and we need consensus, and this is one of the important things. How do you get this consensus? One thing that's clear is that we need a sustainable healthcare system, and one of the tools, and this is what I'm going to insist, one of the tools are the information and communication technologies, but not everything. I must insist in this. Some people think that everything should go around information and communication technologies. But in Catalonia, we think that that's a strategy, putting emphasis on that. And what you can see, and this is a framework, all the Catalan population is insured by a unique public insurance fund. Some other people decide to have a supplementary private insurance, but everybody's insured, and the providers are diverse, and this fragmentation information system of the providers is one of the challenges. And then there are multiple sources of information. How do you make all these providers to coordinate themselves, their information? So what we've done at the ministry level is that ICT has become a strategic component of the Catalan healthcare system. And this is something maybe different from what's happening in the Netherlands, that the politicians, they talk a lot about that, but you still haven't started. But in fact, we've already drawn a map of how we should develop our ICT projects. So this is the general strategy. There is the Ministry of Health, Catalonia. We call, like in the United Kingdom, the Department of Health. And then we've got an agency of health information assessment and quality. So this is an agency that's got different components. It's got evaluation, it's got an observatory, and collects information. And what we've done is we've created a foundation, is called ICT Health Foundation, that is the point of connection between ICT providers and the healthcare providers. So we try to include ICT providers, because what we found is that if each provider negotiated directly with these providers, sometimes they came from Japan, sometimes they came from Germany, from the Netherlands, or from the States, they tried to convince all the single provider. So what we've done is creating this foundation, and we put together the interests of the healthcare providers, including GPs, and here we've got even a council of citizens as well, here included in the healthcare providers, and then the ICT providers. So this is the way Catalonia is organized, and then we, in this strategy plan for 2008-2011 is all accomplished, and now we've developed a 2012-2015 strategic plan as well. I'm going to show the key areas that we've been developing in Catalonia in the strategic plan. One of the main things was to develop the Catalan shared medical record based on interoperability and using common standards between different providers, that their clinical records, their information systems, they could talk together. So this has been developed, is already happening, is already in place. Then what we've done is, what we've done is a medical image digitalization plan. I'm going to talk about it. Then we've got implemented electronic prescribing. It's been a collaboration model between the pharmacists in Catalonia and all the healthcare providers. So the 3,077 pharmacies in Catalonia, they have access to the prescription from any provider of Catalonia. So any citizen in Catalonia, when you want to go to any chemist, being in the Pyrenees, being in the south of Catalonia, you can go with your card and you can have your prescriptions, and the chemist and the pharmacist sees what you've been prescribed and can even give recommendations. So then there is another thing, telemedicine is working. This is an ongoing process. Especially now we are developing a lot with assisted living areas, with people who live at home or people who cannot have access directly to the primary health centers or the hospital centers. This is, but this is being developed in other areas and other regions in Europe. In fact, in South Denmark, they are very advanced in that. And then the personal health folder, this is giving the patients and the citizens a special role. And we've developed that, and we are implementing in different stages. But we've been piloting, and the shared clinical record, the personal health folder, that we don't call it clinical record, is the citizens of huge areas in Catalonia now, they have access to their health information from home. So what it means is that in 2015, the 100% of the Catalan population will have access to the personal health folder. And I'm going to explain you what does it mean. And this is the shared clinical record between different health providers. And what we've done is nowadays Catalonia has got 7,600,000 citizens, so I think it's well, it's a huge area compared with other countries in Europe. It's bigger than Denmark, it's bigger than Finland in terms of population. So a huge number of population are in the system. We've produced lots of documents, and almost all the professionals, health professionals in Catalonia, they are connected to this shared clinical records. So this is one outcome. And then what sort of information is flowing within, where does it come from? And this is, when we talk about aggregated data or aggregated information, this is where our aggregated information comes from. So we've already got the aggregated information in the system. Why? Because the public health insurance collects all this information, and this is centralized. The public health insurance, it doesn't depend directly from the Ministry of Health, but it's the organization, if we could say that it's like the NHS would collect all the information from the whole England, for example. So we've got all this information coming from different levels. You've been talking in detail about some developments in specific areas, how you work in your electronic clinical record. But I'm going to talk a little bit more general, just to put to change the view of this meeting. And then, for example, in the first stages in the clinical the shared medical record, we decided to include this. But now there are lots more things in the shared clinical medical record. So there are diagnoses. We use the ICD-10 codification system, but we are moving into, and we are participating with the WHO classification system and to develop the 11 version of the ICD-11, and then the WIC organization, the classification of primary care, will be included there. So that's a new area. So we are currently working in ICD-10, and then the specialized care, they introduce information, laboratory reports automatically goes into all the clinical records, imaging diagnosis reports, other diagnosis reports, and then some information that comes from the health department, because it works as an insurer. And the information of the citizens is already in the system. This is the electronic prescription, is what I said to you, that all the pharmacists in Catalonia, they are connected with the health system, and there is a big impact in the safety of drug use, because there are lots of reduction in duplication of prescriptions and incompatibility or side effects between prescriptions. And there are lots of warnings. When you go to a chemist, hospitalized and you've been to an emergency unit, and for any reason that hasn't been is not still in the system, the pharmacist sees that the drug that you've been prescribed is incompatible, it's got some side effects with the therapy plan or the prescriptions that you've got listed, because the pharmacists are capable of they can see the prescriptions you've been given. And then there is another thing that 100% of in Catalonia, all the images are digital and they are introduced in the health clinical record. So any test that's been carried out in Catalonia can be seen from any provider, including GPs. They can see all the tests. When I say all the tests, there are even not just radiological tests, there are all the images that you can produce, so even photographs or scopies or any sorts of images you can imagine, including electrocardiogram or the transformation of a spirometry results into something that can be read by the computer system. So this is already happening and is spread around. So this is the digitalization medical imaging plan, follow different strategies. And what's important about that is that, and this is where the Catalan government is being very strategically. How do you manage that, encourage that so many different providers, they put their images into the system? What we did is we gave for free a backup system for storing the images for all the health providers. So backup image is mandatory for all health providers. So what we've done is that we've got a backup module. So all the health providers, they put the backup images there. And this, in the contract, there is that all these images can be shared among all the health providers, including primary care. When I talk about health providers, I always include primary care. So this is the access of images. And these images, at the same time, they've got a report from a radiologist. So they've got some information and codification. So it's not just the image, digital image, so it's something that you can work with its information. And then we've got a telemedicine and telecare plan, and this is where I wanted to talk a little bit more, because we haven't talked very much about what's the personal health folder, and this I think is going into what most of us will see fairly soon. What we've developed is a model that the citizen via internet has access to this folder. That's not the clinical record, but the information from that folder comes from the shared clinical record. So one is the information comes from the shared clinical record. Then what we've developed, and this is the information. The information includes various things. There's reports, blood tests. Time? Yeah, 2 minutes. And then the communication, we use a web 2.0 communication system where patient to patient we can develop patient to patient training, and this is citizen empowerment in a way. We've got professional tools to interact with patients, and we've got and this platform will include a communication system for patient, professional to professional. This is already happening. We've been piloting that. We started with a population of 40,000 people. Now we've passed a test of 250,000 people around Barcelona, and in 2015 that has to be implemented in the whole country. And then there is something else. We are talking about services for personalized services for the citizens, and we are talking about the citizens to be able to use that platform as a social network like Facebook, LinkedIn, and all that. So we are already working on that, and the test is being passed satisfactory. So this is because I haven't got time. This is another thing that in Estonia they've already got. that. Some information goes into the mobile phones. We've been testing that. So the personal folder goes into the mobile telephone. That's been tested in Catalonia and is already happening. So even if you want to ask for a medical certificate, because the information is there, you can apply through your mobile phone and then you get the medical certificate. So you want to go to a gym, you show this is my medical certificate, so I'm healthy, so I can enroll to this gym, for example. This is one application. So what I wanted to say is we go from an e-health approach to an individualized healthcare. And this individualized healthcare, it gives lots of a big role to the health professionals, including the GPs. So this is one of the things. And this is practically philosophy. Where do we come from? From a person searching for health to a person that is an informed health, a individualized health person. So this is the theory. We are currently in Catalonia. We are between here, and we would like to be in 2015 in this area. But the thing is how to encourage people to be proactive attitude. We are we are expecting lots of changes with the new generations. So that we are focusing that mainly to enroll these new generations in what we would say prevention, promotion of new health habits. So we are moving into this theoretical frame. So there are lots of new innovation perspectives. We work in many frameworks. And then we've got data. There is the main health provider of Catalonia. It's got their own system of collecting information. This is what you've been explaining, different softwares. Okay, so I think I'm going to leave it in here because this thing is, you've been talking a lot about the same things. It's more or less the same. There is nothing very spectacular or big changes in how you collect indicators. We've been working, we are in the same field. So this is, I'm sorry for that, Tina, for my long presentation. I would like to say this is images that can be in your presentations as well. Traffic light systems, where you say you are in the bad position. And this is, you can compare between yourself, the GPs from your practice, the nurses between nurses, the GPs compared to the whole Catalonia, to Barcelona. So we've got all these data that you can extract and you can get information. And what's important, and it's very important for us, is that this information is useful for research as well. So if you've got diabetic people with not accomplished, so you can click and you have access to even individual citizens, and you can group people by codification of diagnosis. So you can do this. So these are examples about some blood strips, and this is what we don't want. We don't want citizens being surrounded by technology that's useless, and we think that the citizens are objects. What we want is citizens to be human beings and use technology in a very reasonable way, and being smart enough and giving a role to the health professionals as well. So we are working in European Union projects of interoperability of standards, and Catalonia is one of the examples how to spread, how the different health information systems talk to each other. And I think that's my end. Thank you very much. So if there are 1 minute questions because of the time.